Now, social media surprised this week after actress Gabrielle Union and NBA star Dwayne Wade announced their special arrival. So after years of fertility struggles, the couple welcomed their baby girl Wednesday via surrogacy. Union has been very public about her desires and disappointment, trying to add to their family. In her book, We're Going to Need More Wine. And former First Lady Michelle Obama also revealing that she suffered a miscarriage 20 years ago. She says she remembers her feelings of loss and loneliness, like she failed because she didn't know how common miscarriages were at the time. Mrs. Obama underwent in vitro fertilization to conceive both daughters, Malia and Sasha. Other celebrities have broken the silence about their pregnancy struggles, including Beyonce and Carrie Underwood, and family physician. We always love when she's here, Dr. Jen Caudle, to expand on an issue affecting more women than we think. And good morning to you.
Good morning. And I'm so excited that we're talking about this. And can I just say mad props to Michelle Obama and Gabrielle Union for talking about this. I think so many women, there's so many emotions involved in either miscarriages or trying to have a child when you're unable to. And this really opens up the dialogue. So I'm so grateful to them.
I just did a story with a group of women who shared their experiences of miscarriage, and it's kind of gone viral. I didn't know it was this common. Is that part of why we need to discuss it?
Well, it is. There's so many reasons we need to discuss it, that being one. First of all, miscarriages happen in approximately 10% of all pregnancies. We think of a miscarriage as a loss of pregnancy within the first 13 weeks of pregnancy. And honestly, it is traumatic. I'm not going to say it can be traumatic. It is traumatic, not only for a woman, but for her family. But we also know that miscarriages become more common as a woman gets older and may have other issues as well. So it is common, but it's traumatic and can be devastating.
Gabrielle Union, Michelle Obama, they started sharing their stories, and part of that is sharing the information. So are there specific things that women, especially as you get a little bit older, need to know when trying to conceive?
Right. So I think that, first of all, I think it's important to understand what your goals and what you want out of life. I think that for so many women these days, many of us are delaying childbearing and childbirth and having a family until we're later. We want to have careers and things first. And I'm like, go women, go. I think it's awesome. I also think it's important for us to think about what our goals are. But what I would say, to answer your question, is keeping a healthy lifestyle, keeping a healthy weight, not smoking, not drinking, not using illegal drugs, taking prenatal vitamins, but talking to your doctors about what your family planning goals are. And I would say, if you're a young woman, you've been trying to get pregnant for about a year unsuccessfully, see your doctor. And if you're 35 and older and it's been at least 6 months, that's reason to see your doctor as well, to talk about, hey, is there something going on?
Do you think, and it's hard, I guess, to tell anybody to do this, but do women need to be more open about this? Do we need to have the discussion?
I do, and I'll be honest with you, and I'm so glad that you did that story, featuring women who've had, unfortunate miscarriages. I've been very open about freezing my eggs, which is not the same thing as IVF, but sometimes can be a part of that process. And that's something I've been very open about. I think it's really important to talk about the options when we talk about fertility and pregnancy and the desire to have a family, because honestly, we shouldn't feel shame. And I want people to know also that, miscarriages, and I think this is what I can't speak for Gabrielle Union and Michelle Obama, but I imagine they want people to understand that it's very common, it happens. And also, if this is what you're going through, there is hope. And I think that's the most inspiring thing about their stories.
What I learned in doing that story was we need to talk about it, because we need to learn also how to be supportive.
That's right.
And people don't realize comments that they make could be harmful or hurtful.
Absolutely. And I also like to bring men into this dialogue too. By the way, you said we, and I'm not assuming you were talking about men, but let's talk about men. Men are just as involved in this as women. So this really, I think of it as a family affair and a community affair, actually.
It is always a pleasure to see you.
Always good
Thank
to
you
see
for helping
too.
us expand this discussion.
Thank you.